Today I want to talk about lower back pain. I'm continually asked to help people that are suffering from pain in their lower back. Common cause of that is anterior pelvic tilt or tipping forward of the pelvis. That's going to cause an ache in the lower back, particularly if you're standing for a long period of time, watching sport or whatever it may be. You just want to bend over and touch your toes to relieve that pain. If you're one of those people, here's some stretches and ways that you can relieve that. So it's not just sedentary people that are suffering from lower back pain or anterior pelvic tilt. JP is an elite athlete, plays on the World PSA Squash Tour, also suffered with lower back pain at the age of 27, generating a lot of power with his legs and bending his chassis or his core. Common causes for that, or the main things we need to look at: tight hip flexors pulling on the bottom of the pelvis, and the quads, which are a two-joint hip flexor running across the hip joint and around the knee joint. Weak lower abdominals, also allowing the pelvis to drop. We'll address those in another episode. So 2 stretches that you can try at home to try and relieve your lower back. Okay, the first stretch is a 90-90 stretch, where we have 90 degrees at the front leg, 90 degrees or coming straight down from the hip as well. Reaching up nice and tall with the hands so we're getting extension through the spine. We want to make sure we leave the foot deliberately on the ground so we're taking the quad out of the stretch. The main fault here, hyperextension lower back, allowing the back to come forward and we're therefore not stretching that hip flexor. So we want to make sure we go into full extension, contract the lower abdominals, and squeeze on the glute here to get the hip forward. Reach as tall as possible. You should feel the stretch right at the very top here, which is the hip flexors or iliopsoas at the top going into the pelvis here. The next stretch is exactly the same position. We're now going to bring the foot up and engage the quads as well. We need to make sure we have full extension. JP has the box here. You can use a couch at home, chair in your office, whatever you have access to get into this position. So still in the 90-90, reaching up nice and tall, contract the lower abdominals. It's really important that this hip is in full extension rather than the foot coming to the butt. It doesn't matter if your foot is further back, so long as you're in full extension and you can feel the stretch because you're stretching the quad across here and all the way around the knee. You should feel the stretch at the top of the quad here. Both of these relieving that pressure on the bottom of the pelvis, allowing the pelvis to come back slightly. You could possibly also have been feeling tightness in your hamstrings, not necessarily short, but weak and overextended because of the tipping of that pelvis. So if you have access to bands and those athletes also wanting to advance these stretches, have a look at what we're doing with JP here now. So whenever he comes into training, I'm getting him to stretch with bands because they assist to go through the stretching. The 90-90 stretch for his iliopsoas or hip flexor, exactly the same setup. Up nice and tall, his core's locked. Now the band's giving assistance, pulling forward on the hip. Most importantly, just hold the posture. As you breathe, allow that to come forward under tension from the band. The second stretch, now taking the band here. This is replacing the black box or your couch or whatever you're using previously. Up over the shoulder. Want to get tension onto that band. Take the weight on the front leg for stability. Again, we're looking to get hip extension, so he's pushing forward with this glute. Most importantly, we're not trying to get this band or this foot all the way to his butt. What we're trying to do is to have this under tension and also tension forward. Both the bands are pulling forward on the muscle, so we want to make sure we hold our posture. Hold the core, hold that position in hip extension, allow the bands to do the work. Keep breathing through the stretch. Try these stretches, let me know how you get on.